Hello, Brandon Hepner here from Rock Run Physical Therapy, and today with this video I wanted to explain to you and show you what the top two causes of heel and foot pain are that we typically see in the clinic. The first one is plantar fasciitis, and the second one is Achilles tendonitis. So with plantar fasciitis, basically what that is an inflammation of the plantar fascia, which is a connective tissue structure on the underside of the foot right here. So the plantar fascia originates from the heel bone, or the calcaneus, and runs the entire length of the underside of the foot and attaches into these bones right here at the toes. So how do you know if you have plantar fasciitis? Typically, people with plantar fasciitis complain of a stabbing type pain right here on the inside part of the heel bone. So the undersurface and inside of the heel bone is typically affected. Usually complain of tightness and or tenderness along the entire surface of the underside of the foot. Symptoms are usually more common in the morning with the first few steps out of bed, and then also in the evening after you've been doing a lot of standing or walking. People with plantar fasciitis also complain of pain usually when walking barefoot or in any shoes that maybe don't have good arch support or good support. Plantar fasciitis is usually more common in people who are over 40 years of age, and a lot of times is caused by a decrease in calf flexibility or fallen arches. So that is plantar fasciitis. Now, the next one is Achilles tendonitis. Your Achilles tendon is on the back of the leg, this big thick tendon that runs down the back of the leg and inserts into the back of the heel bone down at the bottom. Your calf is actually made up of two muscles. You have your gastrocnemius, which is the big one that everybody usually associates with your calf, and then you also have a small one right here called your soleus. Both of those muscles together insert into the Achilles tendon or calcaneal tendon and make up that tendon as it comes down and then inserts into the heel bone. Because we have two different muscles there, we need to stretch two different ways in order to target those muscles. So how do you know if you have Achilles tendonitis? Typically you're tender over the back part of the heel bone, and a lot of times 2 to 3 inches above that into this area. Usually complain of some ankle tightness or calf tightness, and a lot of times there's swelling in the back of the ankle, sometimes into this space right here. You can see it a little bit better on the other one. So into this space right here where there's nothing there. So the fluid will accumulate where there's the least resistance. So you'll get some swelling into that space. Achilles tendonitis is more common in males, and in young males it's usually a traumatic type injury, sometimes a rupture, whereas in older males it's usually more chronic, some sort of overuse injury that's causing that to swell up. So that is the two most common causes of foot and heel pain that we see here in the clinic. Feel free to shoot me any questions if you have them, and thanks for listening to the video.